Hi there, and welcome to The Public's Health, the show that puts you, the public, back into public health. I'm Dr. Tony Iton, your host. Today we're going to be talking about a subject that is probably of great concern to you. It's certainly gotten a lot of media attention. Avian influenza, or bird flu, has killed people in various countries around the world, and it has certainly infected a lot of birds, some of which are migratory birds, and the expectation is that eventually it'll come to the United States. We're going to be talking about this subject from a slightly different perspective. You have a daily routine, the things that you need to do to continue your daily lives. You need to go to work. You need to get food. You need to use transportation. Your children need to go to school. And finally, many of us need to get health care. We're going to be talking about this subject from those perspectives. How do you maintain your daily routine? During a circulating pandemic, when the virus is in our community, we're going to have concerns about coming into contact with strangers, people at the grocery store, people at the pharmacy, at the post office, at a variety of different places where we might feel that we could be exposed to the virus. This show is going to talk to you about some simple precautions that you can take and give you a little bit of knowledge about how you can avoid becoming infected by just practicing simple respiratory hygiene, hand washing, the kinds of things that your grandmother always taught you. We're going to talk to some experts, and we're going to see some different settings in which precautions are being taken and planning is being done to try to minimize the risk of exposure in these settings. We all need to do these things. We need life to go on during a pandemic. We hope that this information will help you, help us, keep as many people healthy and safe throughout this pandemic. Thank you. Hi there. I bet I can tell you there's one thing we're all going to do today, and that is to eat. We heard about work during a pandemic and how to maintain that. Now we're going to hear a little bit from experts about how to maintain our access to food. Important, right? We're joined by Kari Martell of the Alameda County Community Food Bank. Welcome, Kari.
Thank you.
Kari, you guys are experts at stockpiling food.
Absolutely.
Now, during a pandemic, I'm obviously going to be very concerned about going out to the grocery store, going out in search of food, because that'll put me in contact with other people who may or may not be sick. So my goal is to limit my contact with people in uncontrolled situations. So what are some of the things I might want to think about in terms of preparing food for myself and my family?
Actually, it's very easy, simple, and affordable. Some steps you can take to prepare for your family in case of a pandemic. The number one thing to stockpile is water. We recommend that you do a gallon per person per day with a minimum of 5 days. If you can store more, by all means, store more water. Once you have that down, you can start thinking about some protein items. Canned goods have a really long shelf life. So your canned tuna, your canned ham, chicken, peanut butter's nice. Maybe a beef jerky, your family might like that. Then think about some vegetables, canned corn or peas. If you don't like it now, though, you're not going to like it then, so pack according to your family's taste. Fruit, there's all kinds of canned fruit. Try and pick the kind packed in its own juice, though, not the heavy syrup. And think about, dried fruit. That would add some variety to your family's diet. You want to get some whole grains in, but, bread doesn't stay long in your garage, so we're recommending maybe a whole wheat cracker, a whole wheat pretzel, something of that nature that would stay on the shelf. And then you can get fancy, kind of add in maybe some sweeteners if you like, sugar in your coffee, and instant coffee if you have to have that. Or think about spices, kind of get creative. Do you want salt and pepper on your foods? Another great thing is the little condiments that you get at a fast food restaurant. Stockpile those. They're small, they add flavor, and they're great to have on hand.
What are some of the things that I don't want to stockpile?
Well, anything perishable, so that would require refrigeration. Now, in a pandemic, you might have your refrigerator and your, stove up and running. That might not be a problem, but to store it in your garage for a long period of time, you just want to use things that are shelf stable. And many packages are made to last. Just check the expiration date, and then you'll be good.
Are there any tricks to keeping perishable items a little bit longer than you might normally be able to keep them?
Well, what we like to recommend for stockpiling is really stick with the shelf-stable items and then check them about twice a year. So when you do your clocks, go out in your garage, look at what you stored away, and if it's nearing the expiration date, rotate that into your family's meal plan and then restockpile.
Ah, clever. Now, how expensive is this?
Well, we'd like to recommend that you shop affordably. We go to a warehouse kind of store. Or another great thing might be to pool with your neighbors and you not only get to know them better, but you can share the expenses of stockpiling.
Now, what if I have special diets? I'm a diabetic, or I'm a vegetarian, or I've got some special need in food.
Well, by all means, know who you're storing for, and usually people know who's in their family. If you have infants, you're going to want to pack, their formula or some Pedialyte. If it's a senior, hydration's important, so lots of water again, and also a liquid supplement such as Ensure or Boost are great. Diabetics, again, they'll know their special needs and they'll want to pack accordingly. Pack your medicines, and again, make sure you have water to take the medication.
That's great advice. Do you want to tell us a little bit more about what's in this?
The goodie bag. If you can kind of make it fun and think of yourself as a chef, traveling to a foreign country with bringing your own ingredients, that would kind of make it fun and seem less stressful. So think about throwing in some, cereal bars for your kids maybe, or they're actually cereal stores nicely. You can do bulgur wheat, your pasta, your rice and beans. So it's pretty much what you cook normally, but just picking items that are going to stay out in your garage for a while.
That's great. So anything else you want to tell our viewers?
Yes, actually, think of your pets. Sometimes we tend to forget that. We're focused on ourselves. And luckily, pet food is affordable. It comes in cans. It comes in giant, bags. And it has a good shelf life, so that can stay out in your garage. So you're going to want to think about your pets as well.
Now, why keep this in your garage?
I am saying garage, and that doesn't mean if you don't have a garage you can't stockpile. That's a good point. You can throw it under your bed. You can put it in a closet, just anywhere where you have some space. You don't want to take over a whole room unless you have the space for that. But somewhere out of the way, but that you can get to in case of an emergency.
What are the best ways to store this stockpile?
Again, just think affordably. You can get a box from your local grocery store, a couple boxes, or think about a portable suitcase. That way you can just roll it with you if you need to leave, and it's just very easy and convenient.
Now, is there a difference between stockpiling and putting your food out of the way and just having more food?
I think there is. More food is, you tend to think of perishable, so you might have more food in your refrigerator or freezer, and I recommend that as well. But the stockpiling is you're really making an effort to put away extra food and water so that it's there in an emergency. Whereas your freezer, you might forget and have a barbecue and cook all your hamburger that you had frozen. You don't want to be caught short in an emergency, so you do want to have it packed away.
I see. Well, that's good advice. So it's a little reminder.
Absolutely.
Okay, great. Well, our next segment is going to be looking at grocery stores. We all have to go there. That's where we get our fresh fruits and vegetables and many of our other items. So what kind of concerns might we have when we're dealing at the checkout counter or interacting with people in the aisles? Stay tuned. Find out. Now, who amongst us hasn't been to a grocery store? And certainly during a pandemic, we're going to need to eat. We're going to need to get the food that either we stockpile or that we feed our children and our families. We're joined now by Dave Heylen from the California Grocers Association, an industry group that represents over 500 retail grocers. Welcome, Dave. Thanks for coming.
Well, thanks for having me.
Tell us a little bit about how the industry is viewing pandemic influenza and its preparations.
Sure. It has rapidly moved to the top of our concern list as an industry overall. Obviously, everybody has to eat, and our country's food supply is, typically considered the safest in the world, and so we're driven to be, to follow that, to follow suit with that. And so many retail companies already have contingency plans in place. The food industry has a long history of dealing with natural disasters, man-made disasters. So the core of a contingency plan is in place. It's just tweaking it to this specific disaster. So overall, I would say that the grocery industry is in good shape.
Great. Well, you're obviously a critical industry. We need you just like we need hospitals, just like we need police and fire. So it's in our interest to know what's going on in your industry, and it's great to hear that you're taking this very seriously. Now, I'm a consumer, and there's probably nobody who's watching this that doesn't go to a grocery store on a regular basis. My concern, particularly with all these doctors running around telling me to avoid contact with other people, is that a grocery store is clearly one of those places where I come into contact with other people. So what do I need to know about walking into a grocery store during pandemic influenza?
The battle plan at this point is to have the individual coming in the store being as best prepared as possible, and that would be, you know, the combination of gloves, possibly a mask, having antibacterial, you know, dispensers available so that you know, an individual can feel confident when they're in the store that they're in a safe environment. So from the consumer point of view, that's key. For the industry, it's educating the consumer through meetings like this, you know, and through flyers, brochures, those type of things that a retailer will have in their store to best educate the consumer. Because if the pandemic occurs, the shopping experience will change. There's no doubt about that.
Many of us have worked in the retail grocery setting, and we've been clerks, we've been cashiers, we've bagged groceries. Now, obviously, we're going to be concerned about having to deal with all the direct customers that are coming in. Some may be sick, you know, we're handing money back and forth. So what have you been working with in terms of your employees on these issues of how to prepare themselves?
In a lot of ways, it's very much the same as the approach towards consumers, and that is, you will see employees, cashiers, whatnot, wearing gloves, masks, using antibacterial lotions and those type of things to keep their hands, you know, clean. And then again, it's education. It's educating the, you know, the cashier or the produce clerk on how you do interact, you know, with individuals, and what you will do and what you don't do.
Well, so it sounds like the grocery setting is going to be almost a little bit like the hospital setting in some ways, which is good in terms of preventing the transmission of the virus. Now, we all are working on continuity of operations plans, and where we look at our key suppliers and our key product lines and our missions. And obviously, you have to worry about your staff being afflicted by some of these illnesses as well, and losing up to 30–35% of your clerks or what have you. So how are you looking at this issue of continuity of operations? Because you are a critical piece of our infrastructure.
You bet. The manpower issue is probably, in many ways, the number one concern, because you're talking about a distribution chain from the field all the way to, you know, someone's table. And so all along those lines there are individuals, transportation, you know, storage, distribution, all of those types of things, even before the product gets to the store. So anywhere along there, you can see the possibility of things going wrong, or there being difficulties in perhaps certain products making it to market. So most contingency plans that I have seen, they're addressing what they will do. You may see stores open for a shorter period of time. You'll definitely see product selection change, as, you know, basic products will probably take up much larger spaces on the shelves, and those items that were more of a luxury and those type of things, you probably won't see those as often, you know, on store shelves.
Because they're tougher to get.
You bet.
What about home delivery, quickly?
Home delivery is, there are companies that are looking at it. There are pluses, but then there are a lot of minuses as well. There's the whole food safety issue, you know, the need to keep, you know, cold foods cold and warm foods warm, you know, the temperature concerns. So you have to have the right vehicles. Well, that means you have to purchase a number of these vehicles and then have the manpower to actually run them. So it's an option, and I think many companies are looking at it, but I don't think overall consumers should look at that as a viable, alternative. It may be an alternative, but I don't see it as being, you know, the answer for everyone.
Well, there you have it. A lot of changes in the grocery industry. And now, what about restaurants?
And now, another episode of Pandemic Detective. Today's episode finds the investigator on the Oakland waterfront.
The suspect in this case is Vi, the virus. Let me dish out the facts. She's small and very dangerous. She travels around the world now and then. She likes birds. She might learn to like you. I'm watching for her. The health department's watching. If Vi the virus shows her ugly mug, we'll be ready. So cover your cough, wash your hands, and keep your eye on Vi the virus.
Brought to you by the Alameda County Public Health Department.
So we've heard about how to stockpile food, and we've talked a little bit about what to be on the lookout for when you're going out shopping in grocery stores. Well, what about restaurants? Some of us love going out to eat at restaurants, and we have questions from time to time, even when the pandemic is not occurring, about how clean that restaurant is and what the staff at that restaurant know about minimizing the spread of communicable disease. We're joined now by Don Atkinson-Adams from the county's Environmental Health Department, and they're responsible for inspecting over 5,000 food establishments throughout the county. Welcome, Don. Thanks for joining us.
Thank you, Tony.
So tell us, Don, give us a sense of what you do as an environmental health department when it comes to looking at food service establishments, restaurants, retail food establishments.
Well, environmental health has a number of inspectors, and each inspector has a specific district that they inspect in. We look at retail food in the county, so that means food that is served to the final person who consumes it. And we go out to these facilities 1, 2, 3, sometimes 4 times a year. It depends on whether it's a restaurant, which probably will be seen at least 3 times a year, and markets that might be seen 1 time a year. We try to look for potential problems because our goal is to prevent illness or prevent problems before they happen. So when we find a problem, we work with the operators to get those corrected. Some of these things may be as simple as correcting the temperature levels on a refrigeration unit or assisting the staff in properly handling certain types of food. Other things may be a little more complicated, like redesigning a hood or redoing flooring or walls, things like that, which may take more time, but might not have such an immediate effect on the safety of the food.
Well, those sound like important controls and things to watch out for. Now, you do a lot of training, or you ensure that the staff in these restaurants has a basic level of understanding about how disease is transmitted. Tell us a little bit about that.
A few years ago, the state passed additional legislation that made it a requirement that there be at least 1 person in each of these restaurants that has basic food safety training. And that person is then responsible for training other people in the restaurant and for monitoring whether people are actually doing the food handling properly. So we do give food safety training classes to the restaurant operators. And then when our staff are out in the field doing the inspections, they try to work with the restaurant employees to be sure that they understand what they're doing.
Now, hand washing is a particularly important aspect of food preparation and food service in general. What sort of things, what might I want to look for when I go into a restaurant to decide whether or not it's a place I want to eat?
Well, when you walk into a restaurant as a customer, or when I walk into a restaurant, I may use the restroom fairly early in the visit, because at that point you can see, is the restroom clean? Does it have soap? Does it have towels? If there isn't any way to adequately wash your hands, then other people who are using it, like the employees, can't wash theirs yet either. And as we have heard in the previous segments, hand washing is an extremely important way to prevent the spread of disease, whether it's flu or whether it's some other disease that you could catch.
Well, that's good advice. Now, one of the things I know we haven't yet started to do in Alameda County or in many other counties is actually train some of these restaurant workers in how to avoid spreading respiratory illnesses. Is that something we might want to consider when we go out to do these inspections and to assure that the restaurants are essentially following good hygienic procedures? Do you think we might want to add some respiratory training at this time if pandemic influenza is on its way?
I think that would be a good idea, and I think it's important to work together with public health to develop some presentations for the restaurant workers so that they do have a better understanding of how they can avoid transmitting disease as well as catching it.
Well, restaurants are certainly one of my favorite places to go, and I certainly intend to continue eating in restaurants even during a pandemic, but we obviously have to balance that against the need to try to minimize our exposure to folks who may be sick as clients in those restaurants, or certainly at restaurants where the staff may be sick. Well, I, for one, certainly enjoy eating at restaurants. Thanks, Dawn, for that important information. And now to Suzan Bateson from the Alameda County Community Food Bank to tell us a little bit about our vulnerable populations and how they're going to maintain access to food during a pandemic. And we're back. And we've heard about food stockpiling. We've talked a little bit about restaurants and what you ought to know when pursuing food at restaurants. We're now joined by Suzan Bateson from the Alameda County Community Food Bank. Thank you for coming, Suzan.
Thank you for asking me.
Tell us a little bit about the Alameda County Community Food Bank.
Well, every day the food bank serves people through a network of 300 organizations out in a community. There are arms and legs. And actually people can call the food bank and find out where they can get emergency food from one of our agencies. We'll direct them to someplace out in a community.
And the food bank works through community agencies such as
St. Vincent de Paul, such as pantries that are in religious organizations throughout Alameda County. Again, 300 partners shows the breadth of our work out in the community.
Mm-hmm. And tell us a little bit about the kinds of populations that you serve with the food that you keep.
Well, primarily our number one customer are children, and then our secondary customer are senior citizens. We serve people who are homeless, people who are unable to get out and to pick up food or to carry food in the community. And we're working very hard to increase our home deliveries to people out in the community as well. And I think that's where it might get interesting in the event of a pandemic.
So in a pandemic, you're going to look at your policies and maybe think about increasing the amount of home delivery and maybe increasing the amount of food you give for people?
Yes, and we also are members of America's Second Harvest, which is a national food bank network. And like in the event of Katrina, what they did is they helped the local food banks in the South acquire more first-run product like bottled water, something I think that we'll all need. And we would work with Second Harvest to increase our contributions of bottled water. Items like that.
Oh, that's great. You're quite a resource. Tell us a little bit about experience that you may have had during earthquakes or the fire disaster, these kinds of episodes. What sorts of things changed? What kinds of needs did you see that you don't see on a daily basis?
More people needed our services, and again, I think that's where food banks and organizations like ours do our best work, is we're prepared to serve those populations that need our help in an emergency situation every single day. And so in the event of an emergency, of course, we go into overdrive. We use resources like America's Second Harvest to get more product in. We get more help from our sister food banks. For instance, if our food bank is able, up and running, and can help other food banks, then we would serve as a staging area. In turn, if our food bank needed more help from the Bay Area food banks, then we would call upon them to help us.
Oh, great. So you have a real network of suppliers and partners in all of this.
I think there's good news on that. We really do have a great, excellent network of help.
Well, that's quite a resource. Now, in a pandemic, we might expect 18 months during which we might see 3 or 4 6 to 8 week waves of the virus coming through our community. And during those periods, we would expect and we would be encouraging people to minimize the extent to which they interact with other people, just to reduce their risk of coming into contact with the virus. How might that affect things like your supplies and how you interact with the people who bring you the food and the people to whom you're giving food?
Well, I think that's something that we're going to be working on. We do have regular meetings that we attend with various providers in the event of a disaster, and we're learning more about that every day. And I think that as time goes by, it's going to be our job to work more closely with that network and really figure out the exact logistics of how we'll move food in and out, or how much food is appropriate to stockpile for ourselves. And another really great thing about our food bank is we're a big partner of Alameda County's. We do dispense emergency food with with funding from Alameda County, and that does allow us to hold certain products and have them available for people in the event of an emergency. So again, I think that's another resource that we have, is we do have food in our warehouse that can tide us over for a while.
Great. How many people do you think you see in a typical week or month?
Well, this will probably surprise you, Tony. We actually serve 40,000 people a week.
Wow, 40,000 people a week.
Yes, it's very surprising that the food bank has that breadth out in the community. But again, we couldn't do it if we didn't have a network of service providers that we worked with on a day-to-day basis. And also we couldn't do it without our volunteers that help us with our helpline, taking calls from the community so that we can route people to the various organizations that in turn hand them food.
What's the one message you'd like people to understand about the Alameda County Food Bank, Community Food Bank, excuse me, and what do you think they need to know in the event of a pandemic when they're worried about going out shopping or to a restaurant, but they need to get food for themselves and their families? What do you want to tell them?
I want to tell them the food bank is here every day to help people in need in a community. We're experts at this. We'll be working even harder in the event of a pandemic, but this is something we do every day.
Well, thank you so much. That is really an enormous amount of information. You are an incredible resource, and I've learned quite a bit just hearing that you serve 40,000 people a week. That's incredible. We will definitely be looking to partner with you in a pandemic, as we do on a daily basis, to see if we can find ways to help our most vulnerable populations.
Thank you very much, and thank you for having me here today.
Some masks are works of art. Others are for fun.
Some masks protect you. Others protect those around you.
Airborne droplets from your cough or sneeze can expose others to influenza.
Use tissues to cover your cough. And if a flu pandemic arrives, please cover your cough with a mask.
For more information about pandemic flu, visit pandemicflu.gov or ACPHD.org. Brought to you by the Alameda County Public Health Department.
And now for some pearls of wisdom from Dr. Bob Benjamin.
Thanks, Tony. We've just heard a very interesting segment on food. It's really important for folks to think about food supply, not only for pandemic flu, but also for all disasters. It's important to stockpile enough food to last, and also you got to think about the kinds of foods that your family both wants and needs. Some people have special dietary needs. Think about dried foods, canned foods, protein, fruits. Be sure to have enough water on hand. In addition to the water, have at least a pound of sugar and a pound of salt in your cupboards, because these are critical in terms of rehydration and the need to replace electrolytes. Thank you very much, Tony. This has been a very interesting segment.
Thanks, Dr. Bob. That was great. We've learned about food today. Join us for our next episode on transportation in schools. We hope to see you then.